Stop what you're doing right now, because if you or someone you love has ever experienced a moment where their vision went blurry, doubled, or simply disappeared for just a few seconds and then came back completely normal, what I'm about to tell you could be the most important medical information you hear this year. Here's what most doctors never get the chance to explain in a rushed 15-minute appointment. That brief, seemingly harmless episode, the one you probably brushed off as eye strain or needing a stronger glasses prescription, may be your body sending you its most urgent warning signal. Not a mild suggestion, a red alert. And I say that not to frighten you, but because the science behind what causes transient vision loss is so compelling and the window to act so narrow that every single minute genuinely matters. By the end of this video, you'll know exactly what those fleeting vision changes mean, which specific symptoms demand an immediate emergency room visit, and what you can do starting today to protect yourself and the people you love. Before we dive into the full breakdown, let me tease something important. Number 2 on today's list is a symptom combination that millions of seniors experience and almost universally attribute to the wrong cause. And that misidentification is literally costing people their lives. We'll get there shortly, and once you hear it explained the right way, you will never make that mistake again. And number 1, the single most critical piece of information on this list is something that neurologists and vascular specialists consider an absolute emergency. And yet the majority of people who experience it simply go to bed and hope it resolves. We need to fix that. Do not skip ahead because the order matters here. Now we're counting down from 5 to 1, ranked from critically important to absolutely life-saving. These are the warning signs hidden inside brief vision changes that every adult over 60 must understand. And every single one of them is actionable right now. Let's begin. Number 5 is something almost everyone dismisses as too simple to be serious. And that dismissal is one of the most dangerous mistakes an older adult can make. We're talking about a sudden, brief episode of blurred vision in one eye that lasts anywhere from a few seconds to a few minutes, then clears completely. You feel fine afterward. Your vision returns to normal. So you do what most people do. You assume it was fatigue, dehydration, or your glasses being dirty. You move on with your day. But here is what the research tells us. A 2019 study from Oxford University followed over 37,000 adults aged 55 and older for a period of 10 years and found that individuals who experienced even a single episode of transient monocular vision loss in one eye, had a 40% higher risk of suffering a major stroke within the following 90 days compared to those who had not experienced such an episode. Now, why does that matter so urgently? Because your brain's vascular system, think of it like a vast network of pressurized water pipes running through the most sensitive real estate in your body. When one of those pipes gets temporarily blocked, even for seconds, tissue downstream is being starved of oxygen. A brief blockage that clears on its own does not mean the danger has passed. It means the blockage attempted to establish itself and the body temporarily overcame it. The next attempt may not be temporary. Here's what makes this especially critical for people over 60. After the age of 60, the elasticity of the carotid arteries, the primary blood supply to both the eye and the brain, declines significantly, and arterial plaque accumulation accelerates. This means brief vision episodes in your 60s and 70s carry substantially more predictive weight than the same episode in someone 30 years younger. What most people get wrong here is timing. They wait to see if it happens again. They schedule a routine eye appointment for 3 weeks from now. But the medical window for intervention after a transient ischemic attack, which is exactly what many of these vision episodes represent, is 24 to 48 hours. After that window closes, the protective benefit of emergency treatment drops dramatically. The right move is same-day emergency evaluation. Not tomorrow, today. Number 4 surprises nearly everyone when they first hear it, because it involves a symptom that sounds far less alarming than it actually is. This is the experience of seeing a dark curtain, shadow, or shade descending over part of your visual field, as if someone is pulling a blackout curtain across one half of what you see. It may last seconds, It may last minutes, and then it lifts and everything looks completely normal again. This specific symptom has a clinical name, Amaurosis Fugax, and it is not an eye problem. It is a vascular emergency. A 2021 study from Johns Hopkins Medicine analyzed data from over 12,000 patients who presented to emergency departments with complaints of transient visual obscuration. Researchers found that among patients over the age of 65 who described a curtain-like visual loss that resolved spontaneously, 28% showed active embolic debris, meaning clot fragments actively moving through circulation when imaged within 6 hours of symptom onset. Within 48 hours, that evidence had largely cleared from imaging, making the cause far harder to identify and treat. Think of what your circulation is doing here, like a river carrying debris downstream after a storm. For a brief period, you can see exactly what's in the water, where it came from, and how to stop it at its source. Wait long enough, and the debris disperses. The river looks clean again, but the source of that debris, arterial plaque, atrial fibrillation, a partially blocked carotid artery, is still there, still dangerous, and still capable of releasing a larger, more catastrophic clot at any moment. After the age of 70, the incidence of atrial fibrillation, one of the most common causes of cardioembolic stroke, increases to affect roughly 1 in 10 adults, and many of those cases are undiagnosed. A transient curtain of darkness over your vision may be your first and only warning that this is happening inside your cardiovascular system right now. The mistake patients make with Amaurosis Fugax is describing it to their family as, "One of my eyes went weird for a second," and then postponing evaluation because the symptom resolved. The resolution of the symptom does not resolve the underlying cause. Get to an emergency department immediately. Number 3 is something you've almost certainly heard of, but I promise you haven't heard it explained quite like this. And understanding it correctly changes everything about how you respond. Double vision, seeing two of everything, or seeing objects that appear offset from where they should be, is often attributed by patients to tiredness, too much screen time, or the need for a new prescription. When it lasts for a few seconds and then resolves, it feels almost laughably minor. But double vision that appears suddenly, is new for you, and resolves on its own is a textbook neurological warning sign. A 2020 study from Stanford Neurology followed 8,400 adults over the age of 55 who presented with an episode of acute transient diplopia, sudden temporary double vision, and found that 34% of those patients were subsequently diagnosed with posterior circulation ischemia, meaning disrupted blood flow to the brainstem and cerebellum. Of those patients, the majority had dismissed their initial episode as inconsequential and delayed seeking care by an average of 4 days. Your brainstem, think of it as the air traffic control tower of your entire nervous system, regulates eye movement, balance, breathing, and consciousness simultaneously. When blood flow to the brainstem is transiently interrupted, the first thing that frequently misfires is the coordination of eye movement, producing that disorienting double image. The fact that it resolves doesn't mean the tower is back online permanently. It means a momentary power fluctuation occurred, and the next one may take the tower offline completely. Here's the aging factor that makes this especially alarming. After age 65, vertebrobasilar insufficiency, reduced blood flow through the arteries supplying the back of the brain, becomes significantly more prevalent due to atherosclerosis. This means that new onset double vision in a senior adult carries a very different clinical weight than the same symptom in a younger patient. What most people get wrong is isolating this symptom. They describe double vision to their optometrist, who may correctly identify no structural eye problem, and then the investigation stops there. But the evaluation you need is neurological and vascular, brain imaging, Doppler ultrasound of the neck vessels, and cardiac monitoring. If your vision doubled suddenly and then resolved, you need a neurological emergency evaluation, not an updated glasses prescription. Number 2 is the symptom combination I teased at the beginning, and millions of seniors misidentify it every year with consequences that are both tragic and entirely preventable. This is the combination of sudden, brief vision change accompanied by any one of the following: a sudden, mild headache, slight weakness or heaviness in one arm or one leg, a brief sensation of numbness around the mouth or on one side of the face, or a fleeting difficulty finding a word mid-sentence. Each of these symptoms on its own can be rationalized. You slept wrong. You've been on your feet too long. You're a bit dehydrated. You're just tired. But when any one of these symptoms occurs simultaneously with or immediately around a transient vision change, you are not experiencing fatigue. You are experiencing a transient ischemic attack, a TIA, and you are in a medical emergency. A landmark 2016 study from the American Heart Association analyzed outcomes for over 52,000 stroke patients across 21 countries and found that patients who experienced a TIA with or without visual symptoms had a 10% risk of experiencing a full, disabling stroke within the following 2 days, and a 15% cumulative risk within 90 days. Furthermore, among patients who received emergency evaluation and treatment within 24 hours of TIA onset, that 90-day stroke risk was reduced by as much as 80%. Think about what that number means. Up to an 80% reduction in the risk of a life-altering, potentially fatal stroke simply by going to the hospital immediately instead of waiting to see how you feel in the morning. The analogy here is powerful. Your cardiovascular system is communicating with you in the only language it has. A transient ischemic attack is not a false alarm. It is a dress rehearsal for a stroke, and the director is telling you the real event is imminent. The body is showing you exactly what is about to go wrong and giving you a narrow, precious window to intervene before it becomes permanent. After age 60, the compounding risk factors, hypertension, hyperlipidemia, diabetes, atrial fibrillation, carotid artery disease, frequently cluster together, and a TIA may represent the moment when that cluster reaches critical mass. The mistake patients make is treating each symptom individually and concluding that because none of them is severe, none of them is serious. That logic is catastrophically wrong. It is the combination and the context that constitute the emergency. If you experience a vision change alongside any of the symptoms I just described, call emergency services immediately. Do not drive yourself. Do not wait until morning. Do not take aspirin and lie down. Call for emergency transport and go. Number 1. The single most life-saving piece of information in this entire video is the one that neurologists and stroke specialists will tell you keeps them awake at night, because the gap between what the science demands and what patients actually do is enormous. Sudden, complete vision loss in one eye. Not blurring, not dimming, but complete blackout of vision in a single eye, lasting anywhere from 10 seconds to several minutes, followed by full recovery, is called a retinal artery occlusion, or, when transient, a precursor to it. And it is a stroke equivalent. Not similar to a stroke, not a warning that a stroke might happen someday, a stroke equivalent, meaning the mechanism is identical, the urgency is identical, and the treatment window is identical. A 2022 study from Harvard Medical School and Massachusetts General Hospital evaluated 6,300 patients who had experienced central retinal artery occlusion and found that 67% of those patients had identifiable, treatable cardiovascular pathology, including significant carotid stenosis, cardiac thrombus, and active atrial fibrillation that would not have been discovered without emergency imaging following the vision event. Of patients who arrived within the critical 6-hour treatment window, clinical outcomes were dramatically superior to those who delayed. Your retinal artery, think of it as a branch of the same tree whose trunk supplies your brain, shares its origin with the internal carotid artery. When that branch becomes blocked, even transiently, it is because the trunk itself is compromised. A piece of plaque broke free. A clot fragment traveled from the heart. The electrical system of the heart fired abnormally and allowed a clot to form. Every one of these underlying causes is a direct and immediate threat to the blood supply of the brain itself. Here is the aging reality that makes this the #1 item on this list. After the age of 65, central retinal artery occlusion occurs at roughly 5 times the rate it does in adults under 50. Risk factors including hypertension, diabetes, elevated homocysteine, and sleep apnea, all of which increase dramatically in prevalence after 60, are each independent contributors. And the silent nature of the symptoms resolution, the fact that vision returns and everything feels fine, creates a false sense of safety that actively prevents patients from seeking care. What most people get wrong about this symptom is classification. They think, my vision came back, so it was an eye issue, not a heart or brain issue. This is precisely backwards. The vision coming back is the eye recovering from a transient vascular event. The heart and the brain have not necessarily recovered from whatever caused it. In fact, the vascular instability that produced the retinal event may be escalating in real time. The treatment window for retinal artery occlusion and for the stroke that frequently follows is measured in hours, not days. Clot-dissolving therapy, carotid intervention, anticoagulation for atrial fibrillation, all of these are time-sensitive. The emergency room is equipped to identify the cause and intervene. Your bedroom is not. If your vision ever goes completely black in one eye, even for 10 seconds, and then returns to normal, you are to treat this as a stroke emergency. Call emergency services. Go to the nearest hospital with a stroke center. Tell them exactly what happened, how long it lasted, and when it occurred. Let's bring this together, because this is the core message of everything we've covered today. Your body does not malfunction randomly. When vision changes appear suddenly, blur, darkness, a curtain, double images, complete blackout, and then resolve on their own, many people interpret the resolution as reassurance. Medicine interprets it as urgency. The 5 signals we walked through today, transient monocular blurring, curtain-like visual loss, sudden double vision, the combination of visual change with neurological symptoms, and complete transient vision loss in one eye, are all manifestations of the same underlying threat, interrupted vascular supply to the brain and eye. That interruption, even when brief, is your body's highest priority warning system, alerting you that something in your cardiovascular or cerebrovascular architecture is failing. The single most important thing you can do right now is share this video with every person over the age of 60 in your life. Show it to your spouse, send it to your parents, your siblings, your friends. The information gap between what medicine knows and what patients do in those critical first hours is where strokes become fatal or permanently disabling rather than prevented. And if you've experienced any of the symptoms described in this video and have not yet sought evaluation, please contact your physician today, not next week, today. Ask specifically about carotid Doppler ultrasound, cardiac rhythm monitoring, and brain imaging. Those 3 evaluations together can identify the majority of reversible causes before a catastrophic event occurs. The window to protect your brain is open right now. Make sure you and the people you love walk through it.